The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to you what you're saying, I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you're involved in a motor vehicle accident, call my office today and schedule an appointment to have an osteopathic evaluation. To my military family, I got your six. To my Masonic brothers, the light is bright. If you wait, it may be too late. Today, I'd like to celebrate with you my 1-year anniversary, so I want to thank everyone. Thank the studio. Thank David Levenstein for giving me this wonderful opportunity to have my own show, the Ask Dr. Tommy O Show, on LA News Radio 103.9. I enjoy educating the community. So I want to thank you for being a part of my family. It's important to educate the community. I always say anyone can prescribe the pill, but are you looking, are you listening, and are you feeling your patients? That's important, and that's what's missing today in our medical practice. We want to just push, one complaint, 5 minutes office visit. Not my practice. You're my family when you're my patients. I keep saying that. If you speak to any one of my patients and you listen to my testimonials, you see the written testimonials, but I also have video testimonials. What physician has that? I'm telling you the experience. They're telling you the experience they have with me. I want you to have that same experience. So give my office a call and let's have a nice chat. We can go over everything, discuss your health, your needs, and you become part of my family. No rush office visits. All right, so again, 1-year anniversary. Thank you. Okay, today's topic, diagnostic imaging. All right, so we hear about diagnostics. Some of us have had diagnostics imaging, so I want to educate you on what they are and just briefly, go over the how they work and what we're looking for. Diagnostic imaging alerts doctors to look. Diagnostic imaging lets doctors, not alerts, lets doctors look inside the body for clues about medical conditions. All right. A variety of machines and techniques can create pictures and structures and look at their activities as well. The type of imaging that can be used depends on the symptoms and the part of the body being examined. These include X-rays, CT scans, nuclear scans, MRI scans, ultrasounds, mammography, and PET scans. Let's talk about X-rays. X-rays are the most common diagnostic imaging studies that we use today. X-rays are a type of radiation called electromagnetic waves. X-ray imaging creates pictures of the inside of your body. Now, if we compare X-rays from 50, 60 years ago to today, there is a big difference. The quality of the image is much better, and as well as the radiation that's being used, it's a lot less. Now we have digital X-rays, especially with dentists. If you go to a dentist, no one's using those toxic chemicals anymore, because, they're expensive and you have to, have the waste removed. And so they finally advanced to where everything's digital. And you have really, really good images. They're fairly clean. Like I said, the images show parts of the body in different shades of black and white. Now, what determines the color of black and white? Well, it all depends on the amount of the energy. I'm going to call it energy, the amount of energy that's being absorbed in the tissue. So something's hard like the bones, those images will be white. Something like the lungs, there's not much energy being absorbed in the tissue, therefore they will be like darker or black. So depending on the density of the tissue, okay, the density of the tissue, something that's very dense will be white. Something that is not as dense will be a lighter gray. Something that is, very, very, it's not really dense at all. I'm trying to say that. Has very little density. That's better grammar there. Will be darker, especially at the lungs. And we're looking for medical pathology, and that's why we use that. Typically, we're looking for fractures of the bone, but we can look for the lungs and see if there's any conditions such as like a pneumonia or some sort of infection or even fluid in the lungs, because we'll see lines going across. We know that there's water in the lungs, especially someone who has congestive heart failure. Next, we have computed tomography, and that's CT. CT is a type of imaging. It's used with special X-ray equipment that makes cross-sectional pictures of your body. We use this to look for fractures, bones, okay, cancers, blood clots, signs of heart disease, and internal bleeding. All right, now, internal bleeding. Well, if you're having what seems to be a stroke, what do? We send you for a CT. We want to see if you have a brain bleed, okay? Because again, we're looking for changes, all right? Density in the tissue versus bleeding. So if we're seeing like a different color on the scan, then we know you have a hemorrhagic brain bleed. CTs, during the CT, you will lie still on a table. The table slowly passes through the center of the large X-ray machine. It is a painless exam. Sometimes you'll need a contrast dye, so we'll be able to emphasize the part of the body that we're examining. The next would be a nuclear scan. Nuclear scan uses radioactive substance to see structures and functions inside of your body. They use a special camera that will detect the radioactivity. For me personally, I have never sat in or experienced using nuclear scans, since I am not a radiologist. I've never seen this. I know we can look at the heart and there's certain parts of the body that we can scan. And with nuclear scan, you have nuclear stress tests. We're looking for, let's say, cancers, so we can see if there's any hot spots. Again, I don't have any experience with this. The next would be MRI, okay? The MRI, magnetic resonance imaging, MRI. A lot of people have heard about this, or if they have experienced this. MRI uses a large magnet radio waves to look at organs and structures inside of your body. We will use an MRI to diagnose a variety of conditions, such as torn ligaments and tumors. We're looking for, this has excellent soft tissue imaging. You don't really get soft tissue imaging on X-rays. I mean, you can get an idea, you can see swelling, but the MRI really details soft tissue. I remember in 1996 up at St. Barnabas Hospital, the radiologist who was in charge of the department, they ordered what we called super coils. And these were top of the line, cutting edge. And they were so good, the scans were so good that the detail for soft tissue and bony tissue were excellent. It got to the point where we really didn't need x-rays. And that's with supercoils. Now, again, fast forward 25, more than 25, let's say 25 years. So the scans are even better now. Again, it comes with a cost. If you have the money, you can get the best coils, the best machines, and then you get the best images. Again, what do we look for? We're looking for soft tissue pathology, and we will be able to detail. We get detailed slices. When we look at MRI, they will use slices. We want thin slices or thick slices, and the radiologist and the technician will determine a set slice depending on the pathology, and you're going to go through the machine. While you're entering the machine, you'll hear the magnet starting to spin, and that's where you get that loud sound. You're going to wear little earplugs to block that sound, and then you have to be still. Again, it's a painless exam, but with it's a lot of excitement because you hear the spinning of the magnets. Lengthy exam can take up to 30 minutes. All right, so I got 15 seconds on the first half. If you're looking for a physician, motor vehicle accidents, chronic neck and lower back pain, give me a call, 631-980-8200, or go to drtomio.com. Welcome back to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, listen to what you're saying, and feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule history and physical. If you're involved in a motor vehicle accident, call my office today and schedule an appointment to have an osteopathic evaluation. Come join my practice. Let me help you lead a happier and healthier life. If you wait, it may be too late. All right, back to today's show, and we were talking about diagnostic imaging, and I left off with MRI, so I just want to give a quick summation. So an MRI, what is an MRI? MRI is a magnetic resonating imaging machine, what's called MRI. It uses large magnets and radio waves to look at organs and structures inside your body. Basically, you enter a tube. We do have a stand-up MRI, or we have open MRI, and I'll explain that. A traditional MRI is a tube, and you're going to lay down in on a table, and the table will gently and slowly slide into a tube. And the tube is, as a tube, it's circular, and we're going to have magnets, and the magnets will start to spin, and that's the sound you hear, that woof. Woof, 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 woof. And that's the magnet as it's picking up in its rotation. You'll have earplugs in to keep that sound down. Contraindications for an MRI, pregnancy, and if you have metal in your can, no metal. Okay, if you have any shrapnel, or if you have knee replacements, hip replacements, any metal, you can't have that because it's a magnet and it's going to want to pull, okay? And it'll try to rip it right out of your body, so we cannot have that. And so that's the first thing we'll ask, is there any metal in your body? If you have staples, we can't have anything in there. So that's contraindication. You have to make sure your doctor knows that you have metal in your body. Pacemaker, can't have that, okay? So, again, you'll have the magnet, it's spinning around a high RPM, and what it's doing is it is looking at the positive and negative charges in your body, and then it sends a signal to the computer, and the computer is able to form an image. Now, we use slices, again, the studies have demonstrated certain slices are better for different organs and depending on the pathology that you're looking for. So this will be predetermined. Either the radiologist will communicate with the technician, and the tech will go into the computer and set up the width of the slices. Okay, and it's it just slices right down. So we're looking for specific pathology. It's a painless exam. Okay, well, it's not exam, but diagnostic test. You just sit there. It takes time. It could be a half hour or so. You have to be still for a half hour. So that's where it's uncomfortable, because you have to be literally still for a half hour so we don't have artifact. Because if you move, it's going to pick that up and then the image will be cloudy. You're going to see artifacts. So we don't want that. All right. So the next would be ultrasound. Okay. Ultrasound. An ultrasound is an imaging test that uses sound waves to create a picture. It's also known as a sonogram. And will take images of organs, tissues, and other structures inside the body. Unlike X-rays, ultrasounds do not use radiation. It's just a sound wave. Just think of like radar, okay? Sound wave, hits an organ, it bounces back, and it picks it up. An ultrasound can show parts of the body in motion, such as the heart beating and blood flowing through vessels. If you want an echocardiogram, basically they put the probe against your chest and we're sending a signal into your body, and then we get an image of the heart. And literally you can see the size of the heart, the thickness of the heart muscle, because it's a muscle and it grows. If you're very muscular, you're an athlete, you can have what we call an athletic heart, and the walls will thicken up and get stronger. If you have congestive heart failure, we're going to be able to measure the size of the heart. Okay, remember, we went over congestive heart failure a year ago. Look that show up. Go on my website or go to Dr. Tommy O. Actually, go to youtube.com/Dr. Tommy O and look up congestive heart failure. Congestive heart failure is when the heart compensates and it gets larger because you have increased resistance in the heart, you have fluid building up, and then the heart will compensate and get bigger. However, it gets to a point where there's an inverse relationship where the size of the heart it interferes with the function of the heart. So as it's getting larger, the function of the heart decreases. Well, we can determine the size of the heart by mapping out and measuring it. We can also look at the blood flow to see if there's back blood flow going into the lower chamber, the ventricles, back into the upper chambers, the atrium, and that would be a murmur. Where we can also determine the force and velocity of the blood, and that's where you get into the Doppler, because there's a little button they can click, or you can put into the computer and check, and then you'll see the Doppler, and we can look at the force and velocity and see if there's any backflow. We can also do this with the carotid arteries, and we're listening for bruits, and we want to see if there's any blockages in the neck. So ultrasounds, I love ultrasounds. We use ultrasounds when you're pregnant. Okay, we're looking. That's across the belly, and then we're looking for the size and the health of the child. However, studies have demonstrated that if we have too many ultrasounds while pregnant, that you can have hearing issues or develop hearing pathology. So we only recommend, just maybe 2 ultrasounds during pregnancy. We also have what's called, a pregnancy ultrasound. We also have what's called a diagnostic ultrasound, where we're looking for actual pathology. And if we want to, the gold standard for a female, we're looking for pathology within the uterus or the ovaries, you want to do a transvaginal ultrasound, not a transabdominal, a transvaginal ultrasound. We take a probe and then we insert into the body, into the vaginal vault, and then we're able to take an excellent image of the female organs. So you want a gold standard is transvaginal. The next diagnostic test or study, that would be a mammography. Okay, mammography. We need to take your mammography. There's certain standards once you reach a certain age, or if we find and discover masses. The standards keep changing because insurance companies get involved and they're looking to cut costs. But I was taught originally 36, now it's 40, and they keep pushing more. But 40 years old, 40, you should have an ultrasound. You want to do self-breast exams every year, and you're going to find something before the physician, and then you'll come in, and then we'll determine if we need to advance. So mammography, there's 2 types again. You're looking for a screening ultrasound or screening mammography versus a diagnostic mammography. What's the difference between the two? Depending on the number of actual scans and the angles. That's it. That's the difference there. All right, so I have about a minute and a half left. So you want to have your mammos, you have everyone, diagnostic centers offer it, but you want to definitely make sure you go to someone who's really, really qualified and they're good with the scans, because the results, it's determined by the skill of the individual performing the test. So we're getting into a minute and 15 seconds left. So next would be PET scans. Okay, this is relatively a new diagnostic study. The technology's been around, but what they did was they combined two different studies. So we got X-ray plus the CT. This is where we're able to scan your entire body. You hear someone, well, I had cancer, or we want to rule out cancer because it's very expensive. And then you'd go in and they would scan your entire body from head to toe. Especially if you had cancer, we want to see if there's any hot spots in the body, or you had, like I said, if you had cancer and after treatment, or if you want to do a screening, you can do a screening. Not all insurance companies will cover screening. That you'll have to pay out of pocket for that one, and it screens your entire body. We're looking for hot spots. Okay, so I have about 20 seconds left. I hope you enjoyed this show. This is a little bit different. No one really talks about diagnostic studies. I typically go over diseases. Okay, so let me help you lead a happier and healthier life. Come and join my practice. You want to learn about my practice? Go to drtomio.com. That's drtomio.com.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.